Hello, everyone. Thank you for joining us this evening to discuss this very timely topic, ambulatory anesthesia in the COVID-19 era. For those of you who do not know me, my name is Basim Abdimalik. I'm the current president of SAMBA. I'm professor of anesthesiology at Cleveland Clinic in Cleveland, Ohio. Well, if you're not a SAMBA member yet, I'd like to encourage you to consider joining us. Please visit our website at sambahq.org, where you're going to find a lot of membership benefit. I hope you'll find those attractive and you will consider joining us this year. Before we get started, I would like to go over a few things. First, I'd like to share with you that the SAMBA leadership has put together this COVID-19 resources webpage on our website, again, sambahq.org. Over there, you'll find a lot of links that I hope you'll find helpful. As you know, this is a fluid situation, and we're getting information every hour or so, and we try to keep up with it. We put a lot of resources there. If you go there and you see something that's not there, or you know a resource that you think would be helpful to our colleagues, please send it to us at info@sambahq.org, and we'll be happy to put that up there for you. You'll also find there an open discussion forum that we put together where we can engage with each other and we can share thoughts, ideas, best practices, as well as news, what's going on in our world and so forth, so we can help each other out, support each other out, and advance patient care, advance the profession and the specialty. Before we start this webinar that we put together for you, and I really appreciate you joining us in such a short notice. We all know its situation is kind of hot at the moment, and we'd like to go over a few things with you in that regard. In this webinar now, each of you will have a control panel, could be found in the right upper corner in your screen. For the most part, it will be in listening mode only during the presentation, and then after that, for the question and answer session, we'll have it open. We do encourage you, though, however, to enter your question in the question box if you have any questions during any time of the presentation. And we'll get that after the slide presentation. We'll have a chance to answer those questions and those that we have received already. In the chat box there, please post any comment that you wish to share with your colleagues. And also, if you have any technical difficulty, if you could put that in there, our staff will be monitoring that and will be able to help you immediately. I'm very pleased today to be joined by two panelists, Dr. Bobby Jean Schweitzer, Professor of Anesthesiology, University of Chicago. She's also the SAMBA Vice President. And with us as well, Dr. Leo Rodriguez, who is the SAMBA President-elect. He has been the Medical Director of the Ventura Surgery Center since 2008. Dr. Rodriguez, I would like to thank you because you, in such a short notice, prepared this great presentation for us. So without any further ado, I'd like to introduce to you Dr. Leo Rodriguez, who's going to be talking to us about COVID-19 and ambulatory anesthesia. Thank you. Leo, you have the screen, please.
Thank you very much. Good evening, everyone. I am not a professor of anesthesiology. I'm a private practitioner. I practice anesthesia in a freestanding ambulatory surgery center, but I also participate in organized medicine. So I'm part of Envision Physician Services. I'm the Assistant National Medical Director for Ambulatory Anesthesiology. And our company has many contracts in surgery centers of different owners of surgery centers. And so I have a lot of interaction with medical directors, executives, vice presidents of different companies. And this has helped me build this presentation because we're all trying to work together to help each other out during this time of crisis. And so right now, the big news is there is a nationwide elective surgery restriction. And people are asking why. We're getting a lot of questions. Why are we restricting ambulatory surgery? And how long is this going to go? The answer to that question, we don't know how long it's going to go. We can tell you that about 20% of infected patients with COVID-19 are going to require eventually hospital care. And in the United States, there's approximately 2.8 hospital beds for every 1,000 people. That's about a million beds in the United States. And we also know that there's about 3.6 ICU beds per 10,000 people. And what the government is trying to do, because we have such limited resources, is to create a program of social distancing. And by doing that, we're going to spread the infection rate to a slower rate, and this will allow the government to provide healthcare to people in a easier manner than if we suddenly get a peak. So if you look at the graph that I'm showing you here, in the dark purple, you'll see what would happen if any